Thanks for having me here. I think I have one of the best jobs in Methodist, which is to innovate. So I am blessed to have dollars from CMS, a lot of millions of dollars to innovate. And so my job is to really help to break the stigma that surrounds mental illness. So I really appreciate the opportunity to be here because we have an opportunity to recognize what the correlation between depression and congestive heart failure or any other heart disease. So some of the symptoms that we look at are the depressed mood, anxiety, the weight loss, the fatigue, the loss of energy that we heard about. And we're going to also look into some of the coping skills that exist. And a key part is when you go to your physician, this is your opportunity to talk about your feelings. How do you take control of your disease? And activity is a huge part of it. How do you realize when you're fatigued and you need to really use that as a marker for a shift in your health? Join and support groups. In this group, there is not a lot of support. In a lot of the other disease states, there is good support, so we really need to recognize what that looks like. And again, discussing your feelings. In Methodist, we now have rolled out where we're gonna be screening patients for depression in all our clinics, so that's an early indicator of an opportunity to start the discussion. So the tool that's used for screening, and we've rolled this out April 1st in all Methodist facilities, is the patient health record. So the key parts again is looking at yourself for shifting your mood. Do you feel hopeless? What's your sleep like? And your activity levels are key. We're seeing a huge uptick in the US for suicidality. So question number 9 on this tool is also our early indicator to recognize when someone is at risk for suicide. And we have interventions in-house. We've rolled out telepsychiatry in all our Methodist emergency rooms, so we have access to psychiatrists to be able to start working with individuals who are high risk for suicide and depression. So that's the key part of the slides. I want to talk about a huge intervention that we've started using at Houston Methodist, which is pretty free. We have a donor who just donated the salary for a music therapist. Music is a free therapy that you can use for yourself. There's a lot of research that's showing the correlation between using music to change your heart rate. So when you go home, find music that you enjoy, use that as a part of your routine, and you will really see a shift in how your mood is going. So that's a free prescription. When you're home, turn on the music. It's pretty easy.